So now, selective serotonin reuptake inhibitors. We learned in the other diagram that the drug inhibit the reuptake of IST only and not NA, right? Let me just, yeah, this only 5-HT, not NA in this diagram. Now, lack of anticholinergic and alpha blocking properties. एंटीकोलिनर्जिक नहीं होता है lack lack of anticholinergic मतलब cholinergic cholinergic alpha blocking properties. SSRIs are actually the first choice of drugs for depression, phobia, OCD, PTSD, bulimia, and premenstrual tension, and panic attacks also. Panic attacks is actually anxiety. Now, because they offer several advantages over TCA, तो इसमें एंटीकोलिनर्जिक इफेक्ट नहीं होता है, इसमें सेडेशन और वेट गेन नहीं होता है, नो प्रोपेंसिटी टू कॉज सीजर्स, एरिथमिया. तो इट्स वे बेटर देन TCs that we use SSRIs, बट ये ओनली 5-HT को ब्लॉक करता है, मतलब 5-HT का रीअपटेक ब्लॉक करता है एंड इसका NA का नहीं. SSRIs are now the first choice of drugs for depression, OCD, PTSD, bulimia. ये तो यहाँ पे लिखा ही हुआ है. Now, if adverse effect, actually nausea is the most frequent complaint about the use of SSRI. Anxiety is the next most common adverse effect. Anxiety, effect followed by diarrhea. So these three are the adverse effects: nausea, anxiety, and diarrhea. Other CNS problems like headache, insomnia, they're also common. These can also cause inhibition of ejaculation and anorgasmia. So if these are given to a male may have, because sorry, ejaculation and anorgasmia means there'll be no orgasm and ejaculation will also be inhibited. अगर if we give SSRIs with MOA inhibitors, it can cause serotonin syndrome. ये तो हमने देखा ही था, पर आई एम नॉट श्योर वो पेथिडिन के साथ था. Hmm, शायद वो पेथिडिन के साथ था. डिस्कंटिन्यू SSRI, हाँ, sorry, non-selective increase the risk of seizures. Pethidine वो seizures होता है. Yeah, serotonin syndrome. Serotonin syndrome. SSRIs can cause akathisia also. SSRI, इसमें क्या होता है ना कि MAO inhibitors, we have to like stop, we have to, before starting we have to at least wait for the 14 days, because इतना टाइम लगता है regeneration of MAO, तो serotonin syndrome होता है. Now, SSRIs affect platelet serotonin level. तो प्लेटलेट में भी सेरोटोनिन रिसेप्टर्स होते हैं, तो उनके लेवल्स को अफेक्ट करता है प्लेटलेट में. An abnormal bleeding can occur. So sertraline and citalopram, they appear to be safest SSRIs to be used with warfarin. Sertraline, citalopram appear to be safest SSRIs. तो वारफेरिन के साथ हम ये दे सकते हैं सर्ट्रेलिन और citalopram because now fluoxetine ये तो हमने पढ़ा ही है. Fluoxetine is a prototype of SSRIs and longest acting drug in these group. Fluoxetine and fluvoxamine. It's the shortest acting SSRIs. Mm, fluoxetine, yeah, it's the longest acting. In this group, it is metabolized to norfloxetine and retains the antidepressant activity. Shortest acting. Now, paroxetine, sertraline and citalopram इन दोनों के साथ warfarin safe to give. Escitalopram is the most specific SSRI, most specific. Paroxetine is more teratogenic. Paroxetine, teratogenic. Fluoxetine, paroxetine, ये SSRIs है ना. Sertraline and citalopram, they are good with warfarin. Now, fluoxamine is actually the shortest acting, and fluoxetine is the longest acting SSRIs. Now, paroxetine, it is the most teratogenic SSRIs, and there's escitalopram also, which is the most specific SSRI. Now, an atypical antidepressant, these drugs may or may not increase the aminergic levels or possess the different antidepressant mechanism. तो इनका mechanism of action different ही होता है. Now, trazodone, it's actually 5-HT2 antagonist. It's a prominent alpha blocker and weak 5-HT2 antagonist. इसमें ऑल्दो लिखा हुआ है atypical में 5-HT2 antagonist, but it's a weak one. Sedation and periapism. Periapism is prolonged and painful erection and postural hypertension. Trazodone अगर लेगा इंसान तो there will be sedation, priapism, which means prolonged and painful erection and postural hypertension. तीन चीजें होंगी. Myanserin is actually Myanserin or it's a alpha 2 blocker antagonist, but they act presynaptically. The seizure augmenting and bone marrow depressant action restrict its use. तो bone marrow depression होता है इससे and seizure भी होता है इससे. Now, tianeptine and epinephrine, they act by enhancing the serotonin reuptake. तो ये serotonin जो होता है reuptake enhance करते हैं. opposite action होता है SSRIs. Mirtazapine, they inhibit presynaptic alpha-2 receptor and this increase the Na and 5-HT release due to inhibition of auto and hetero receptor respectively. Although it increases serotonin level in synapse, there is selective activation of 5-HT1 receptor. तो एक्टिवेशन हो रहा है 5-HT1 receptor का due to antagonistic activity at 5-HT2 and 5-HT3 receptor. HT2 and HT2 HT3 में तो antagonistic activity हुई है and 5-HT1 में there is activation. Therefore it's known as non-adrenergic and specific serotonergic antidepressant. Specific है because mirtazapine. Also, it has minimal sexual side effects compared to SSRIs. Commonly causes sedation, weight gain, lipid abnormalities like hyperlipidemia and dizziness. Vortioxetine. Vortioxetine, it's a 5-HT1 agonist with a serotonin reuptake inhibitor. तो reuptake inhibition reuptake eggs inhibit करता है reuptake with 5-HT3 antagonist but 5-HT1A agonist है so it is indicated for major depressive disorders. Depressive disorders में use करता है bupropion. It inhibits the uptake. Bupropion uptake inhibit करता है more significant selective Na and reuptake inhibitor होता है actually. Bupropion increases presynaptic release of तो presynaptically it increases the release of the catecholamine. It is metabolized to amphetamine like compound and possesses excitatory properties. Bupropion amphetamines जैसी activities होती हैं इसकी. So it is used for smoking cessation. So if you have to like smoking cessation में use होता है cysteine and acetylcysteine released formulation and it can also precipitate the seizure. Nafazodone, it's actually it blocks serotonin reuptake and antagonizes 5-HT2 receptors. Serotonin reuptake block करता है 5-HT. Nafazodone ये 5 वही है उसके साथ का ही है Trazodone क्या है. It lacks anticholinergic effects and agitation. It has a very short life and it is hepatotoxic also. Now, atomoxetine is actually selective inhibitor of Na uptake, Na reuptake, and it is useful for attention deficit hyperkinetic disorder. Atomoxetine. The attention deficit hyperkinetic disorder. That's efficacy similar to methylphenidate. Vilazodone. It's actually Vilazodone is 5-HT1 agonist with serotonin reuptake inhibitor. तो जो हमने पढ़ा था यहाँ पे तो reuptake तो inhibit करता है बट जो यहाँ पे 5-HT1 receptors होते हैं उनको that is partial agonist at there. Uses of the antidepressant depression enuresis nocturnal basically imipramine use करते हैं phobia recurrent panic attacks eating disorder bulimia स्मोकिंग सेसेशन में हम प्रोपियोन यूज करते हैं, राइट। प्रोपियोन स्ट्रेस डिसऑर्डर के लिए, इम्पल्स डिसऑर्डर क्लेप्टोमेनिया में यूज करते हैं हम इम्पल्स डिसऑर्डर, वेरी, यस। ओके, OCD and neuropathic. When I used to live in hostel, there were so many people who were actually kleptomaniac. My roommate was one of them. My roommate and not so many actually. There were two people who were kleptomaniac. My roommate and this other girl I knew, probably like impulse disorder. Okay, so uh, lithium, it's a small monovalent cation that does not produce any acute effect, but on prolonged use, it acts as a mood stabilizer. It has no psychotropic effect in normal persons. Mechanism of action, some neurotransmitters in the brain, they act on the G protein coupled receptors. On G protein coupled receptors, the IP3 and DAG. Oh my god, कितने दिनों बाद सुन रहे हो इनका नाम. G protein का formed from PIP2, the second messengers. IP3 is metabolized to regenerate PIP2, PEP2. Activity of these pathways is postulated to be markedly increased during the manic episode. तो इनका जो एक्शन होता है ना PIP2, IP3, DAG, तो ये इंक्रीज हो जाता है इनमें मैनिक एपिसोड में, बहुत ज़्यादा इंक्रीज हो जाता है. तो lithium basically inhibits the regeneration of PIP2 by inhibiting the enzyme inositol monophosphate, thereby decreasing this activity. Yes, ये G protein coupled receptors. इसमें क्या हो रहा है कि so IP3 जो लिथियम होता है इनहिबिट करता है IP2 को IP1 में कन्वर्शन और IP1 का inositol में कन्वर्शन. PIP and PIP2 यहाँ से DAG निकल जाता है, then PIP3. So in addition, lithium and valproate inhibit glycogen kinase synthesis kinase 3 GSK3. GSK3 को inhibit करते हैं. Enzyme involved in degradation is मतलब जो BDNF है ना, brain derived natriuretic isn't something factor. This action is likely to be involved in the use of lithium for unipolar depression. It also has narrow margin of safety. It takes 1 to 2 weeks to exert its maximum effect. It is a drug of choice for prophylaxis of the bipolar disorder. Yes. Its T half is 24 hours. Lithium is the only drug used in the bipolar disorder which has documented anti-suicide properties. Shit. It can be used in acute mania, but benzodiazepines like lorazepam must be added due to slow action होता है इसका. Narrow margin of safety also there. Low therapeutic index. So in patients not controlled by benzodiazepine antipsychotics like olanzapine is atypical antipsychotics, and plasma concentration of lithium should be 0.5 to 0.8 milliequivalent per liter for maintenance therapy of bipolar and zero point 0.8 to 1.2 for acute mania. Acute के लिए तो थोड़ा ज़्यादा ही होगा. Now toxic symptoms are seen if plasma concentration exceeds 1.5 milliequivalent per liter. तो अगर 1.5 पहुंच गया है तो that means toxic symptoms will appear. And diuretics like thiazide, they decreases the renal secretion of the lithium, तो toxicity obviously होगा. Something which is not letting it go out of the body will increase the toxicity, and this is due to increased reabsorption of the sodium and lithium ions. Yeah, lithium is also plus, तो इसके साथ साथ ही हो जाए as a compensatory response to excessive loss of sodium. Now, effects क्या क्या होते हैं? Leukocytes, other effect leukocytosis होगा शायद से. Leukocytes increased tremor. Oh, it's a mnemonic. Most common side effect: hypothyroidism, increased nephrogenic diabetic insipidus. DI होता है, DI हो सकता है, tremor हो सकता है, hypothyroidism can be used for the treatment of CRT, and urine amyloid is DOC for lithium induced GI. तो अगर लिथियम से इन डायबिटीज इंसिपिडस हो रहा है तो हम एमिलोराइड दे सकते हैं. Emerald would be drug of choice, and should be avoided in expectant mothers because of Epstein's anomaly. Epstein's anomaly क्या होता है? Epstein. मैंने क्या लिखा है? Analomy. Epstein is a rare defect that present uh, the valve flaps are malformed. So Epstein's anomaly, tricuspid जो valve होता है, tricuspid deformed. Doesn't work properly. Does work properly. तो congenitally mothers में नहीं देते because it will call Epstein anomaly. इसका मतलब ये है कि tricuspid जो होता है वो deformed, उसके जो valves होते हैं, leaves होते हैं, they are deformed, so it doesn't close properly. Also, it's not on the same, it's not in the proper position, and the heart doesn't work. It's less efficient. It doesn't work properly. Acne and weight gain is one of the few things that happen adverse effect, and also can cause benign and reversible elevation of T waves. Alternative क्या होगा? Carbamazepine दे सकते हैं, valproate दे सकते हैं, they're useful in manic depressive psychosis में, and this can also be used for acute mania. Valproic acid is actually valproate only, as a treatment of rapid cyclers like 4 cycles अगर हो रहे हैं, more than 4 cycles in a year, तो valproate दे सकते हैं हम. Benzodiazepine like lorazepam, they are the drug of choice for acute mania. Acute mania हम BDZ देते हैं. Olanzapine and other atypical antipsychotics show efficacy in bipolar disorder as well as acute mania. Lamotrigine is specifically used for depressive phase of the bipolar disorder. Lamotrigine तो हम BTZ और valproate मैनिक एपिसोड में देते हैं और lamotrigine हम डिप्रेसिव फेज में देते हैं. और अगर टॉक्सिसिटी हो गई तो हम क्या करेंगे? लिथियम टॉक्सिसिटी हो गई है. लिथियम टॉक्सिसिटी हो गई है तो हम क्या करेंगे? There will be acute and toxic vomiting, diarrhea and cause tremors वगैरह होंगे obviously. Diabetes insipidus, hypothyroidism होता है. More serious effects like mental confusion will be hyperlexia and dysarthria will be there. Seizures and cranial and focal neurological signs. Coma death भी हो सकता है. Other toxic effects are cardiac arrhythmia, hypertension. तो ये सब होने लगता है ना. तो there's no specific antidote for lithium. लिथियम के लिए कोई एंटीडोट नहीं है. And dialysis is most effective means of removing LI from the body. तो dialysis करेंगे. अगर 4 मिलीकुलिन से ज़्यादा है acute overdose में और it is indicated at serum levels less than 4 and more than 1.5 milliculin liter and chronic overdose. Anti-anxiety drugs. Much needed reduction in GABAergic activity. So let me see. Let's do it in the next video. Thank you. I'm really tired.